The position of the NMA on the Affordable Care Act is that we truly believe that this is ground-changing work, that it will lead to a paradigm shift in medicine, and hence the name of our convention, the paradigm change in medicine, the Affordable Care Act.
What will it mean for both patients and physicians?
Well, what it would mean for patients is that we're going to have a shift from reactive medicine to proactive medicine. We're going to practice prevention as opposed to reaction. We like to think of it this way. We want people to stay healthy longer rather than to get well soon.
Access to health care in all of its forms has historically been a problem in America, and not just for African Americans and new immigrants to this country. It's also been a problem for poor Americans across the board. This legislation was critical in not only providing some significant changes in the healthcare system which prevented insurance companies from discriminating against the sickest of our patients that we had the most trouble treating. And of course, African Americans are very sick when they get sick as well. So that was a significant number of our own patients. It also expands health care to many uninsured patients and expands Medicaid. And of course, once you do something like that, it's much harder to discriminate and to provide less health care and to distort reality and cause problems for us when we try to do the best we can to provide that health care for our patients. So it's critical at this juncture that we come together, make some decisions, and do what's necessary. The NMA stepped forward to provide testimony and support for not only this legislation. Every single year, there's a president of the National Medical Association, since it was founded, has supported universal health care for this country. So we are not any Johnny-come-lately. We were the only National Medical Association to support the establishment of Medicare and Medicaid. So you know that we have to stand up tall now, because those that want to prevent the least of us from having that access will do that if we allow them to. It took many, many years for this to be accomplished. If they take it away from us now, it may never happen again. So we have to use the same fervor, the same energy, the same organization, the same effort to try to maintain what's been achieved and expand upon it, improve upon it, make it better for everyone. But we can't let those that distort reality, perpetuate lies, and try to take away the improvements in health care that have been achieved. So today, hopefully, we can address what it means now that the Supreme Court has pretty much solved the issue as to whether it's constitutional or not. The individual mandate clearly is, but there are some changes that will affect all states as it relates to the expansion of Medicaid, which could have a permanent effect on the way this legislation progresses and whether it's successful. There'll be many attempts to try to appeal it, to try to distort it, to try to change it, to try to substitute it. But, you know, we didn't come all this way to turn back now. So what I hope that all of you with your brightest ideas will come forth and we can develop an advocacy plan to help support the implementation of affordable care for not only our patients, but this entire country. And that pretty much ends my remarks this morning. Thanks for being here.
The good news is the Affordable Care Act is already working, and so this is a great opportunity to make sure that the successes continue. There are many, many reasons to support the law, many, many reasons why the NMA supported the law, and the NMA was public about its support for the law. The many millions who will be insured who are not currently insured, the increase in the number of people who will get timely care, and therefore greater access, the decrease in inequity, the fact that system reform will lead to better care, which leads to better health, and usually at lower cost if we do it right. As I said, the Affordable Care Act is already working. Already, seniors have saved almost $4 billion in prescription drugs alone, just since the law was passed. You've heard about the young people who can stay on their parents' insurance plans. Nobody can be denied coverage because of pre-existing conditions. Insurance companies can drop you just because you get sick. They're obliged now to pay a larger share of your premium on your care. Now, everybody knows that the CEO always needs his bonus, and the corporate jet is always important, and the golf outings are important, but your care is more important than that. Whatever is not spent on direct patient care is coming to you or whoever's paying for your care as a rebate check, and Uncle Sam is actually watching that. There's more money now for prevention. There's more money for care coordination. This is an important point. One of the provisions of the law was that an office was created in the Centers for Medicare and Medicaid Services to coordinate the care for those who are eligible for both Medicare and Medicaid. They call them dual eligibles because they're eligible for both programs. And now there is a greater focus on coordinating their care because as a population, we spend more on their care than anybody else. So there's a greater commitment to do that. There's a greater commitment to primary care, a greater commitment to innovation. In many other industries, innovation becomes mainstream a lot faster than innovation becomes mainstream in healthcare. We need to change that. The Affordable Care Act wants to do that. There are about 50 million uninsured people in America. Think about that. That's the combined population of 25 states. Consider 25, half of the states in the union, all the people in them underinsured. And a lot of these people are the most vulnerable people in America, the people who need the care the most. A lot of them living in these states where their governors and their state houses don't want to expand Medicaid. This is a vital point for this discussion this afternoon, because it means that these most vulnerable people, a lot of whom you see every day, are the most needy and are the people that would benefit the most from the Medicaid expansion, but many of them unfortunately live in states where the people who run the states for whom they voted, a lot of the people who run these states for whom their taxpayers provide health care for these very elected officials, by the way. Think about that. A lot of the people who are uninsured in this country, 4 out of 5 of them work. 4 out of 5 uninsured people in America work. That means that they're taxpayers. That means they pay for the health care of the elected officials who have said in public that they should not get care. So let me say it another way. I pay for your care. Uncle Sam is giving you money to pay for my care, and you say no.
I wanted to make a comment, number one, and just a question about what some of the laws are that are kind of in this bill. First of all, I do agree that this is a step in the right direction, but because Massachusetts, as has been already stated, has had universal health care for many years, and in fact, our current rates of uninsured is about 1.3%, which is fantastic. However, that's great. What I want to point out is that health insurance does not equal access.
No.
Okay? And so I have lots of patients for whom they were previously on Medicaid and now are on the universal health care plan that Massachusetts has, and now they're underinsured. So before, their medications were covered, they didn't have the high copays, and now because they're on these insurance plans, they have these very high copays that make care more restrictive for them, in fact. And then for our populations in particular, African Americans, we find that transportation and access to viable alternatives in their community in terms of whether it be cancer care, screening, et cetera, is lacking. One of the things that I find reprehensible is the fact that in my institutions, I work for a very large hospital that's there in Massachusetts, we have people who literally will step off the plane from another country, come to my hospital, and get free care. And I have African Americans who I know have worked, paid taxes, who have lived in the community and supported their community for many, many years, and they can't get assistance. So I didn't know if there was anything in the current regulation that speaks to the question of whether or not someone needs to be an official United States card-carrying member.
Yeah, it does.
Dr. Renee Settle Robinson from Milwaukee, Wisconsin, and I
Welcome.
am a podiatric surgeon and very excited to be here because I see commitment in this room, which we desperately need. I'm on staff at the newest hospital in Wisconsin, in one of the most affluent communities just outside of Milwaukee, and I'm the only black doctor on staff at that hospital. I went to their annual medical staff meeting, and they had Tommy Thompson as their keynote speaker. And I stood up and asked him, has he ever supported any form of universal health care? He said, absolutely not, and my goal when I get elected is to get rid of Obamacare. That's what we're fighting against. And that's the face, along with everybody else from your own communities that think the same way, that need to be brought down. Because NMA, and I'm very proud of this, we would not have Medicare had it not been for the NMA. And how many of our elders have benefited from Medicare? I'm looking forward to it myself because I'm not too far from it myself now. But when we look at the rest of our country that has no insurance, Obamacare is a godsend.
My question is this right here. I spoke to a doctor years ago. My son was in school, and she said that during the time when children go back to school, she spends a little extra time in this low-income area in Benning Road to make sure these children are developing before they go to school. And she said that she was berated by her head doctor for spending that extra time to make sure that this child was prepared for school and making sure they had hit all of their developmental benchmarks. My question is this: how do you intend to ensure that you do not have doctors who care about children, especially children in low-income areas and in shelters, that very rarely get this care and only see a doctor sometime in emergency reasons and going back to school for immunization? How do you make sure that that level of care is consistent with that right there? Because she said it bothered her, and she said that's why good doctors go to the suburbs and they leave nonprofit-style health services for this reason.
The Affordable Care Act is very essential to be implemented in the United States. The Supreme Court did approve the individual mandate. The Supreme Court also allowed states to expand Medicaid as they felt they should expand it. And what this focus was on what physicians should do and other advocates for health care in order to promote this legislation. Currently, a lot of states have gone very slowly in implementation. They have not really formed the exchanges that are necessary in order to provide health care plans that will provide the benefits that patients actually need and can afford. At the same time, many of the states have simply not implemented it at all. And in that, means preparation for the expansion of Medicaid, and some have intended not to accept Medicaid expansion dollars, even in the state which I currently live, Texas, and this state, Louisiana. So it's a big problem. The message here is to certainly encourage implementation of this particular legislation all across America to make sure that voters know in the coming election that it's important that the legislators represent their views and support them. And so our message today is patience before politics.
What we would want people to know after this conference is that the National Medical Association cares as much for its patients as it does for its members. In fact, we stand with our patients on these issues that affect not only their health, but their communities and their lives. That would be the Affordable Care Act. That would be issues such as diabetes, hypertension, congestive heart failure, and hepatitis C.
The National Medical Association is convening its annual convention, our scientific assembly and convention, and really the physicians of the National Medical Association are the brain trust of African American health. We have been on the battlefield fighting for health disparities and health equity and raising awareness. We represent over 50,000 African American physicians in this country.
What are some of the major issues?
Some of the major issues in our national platform now, number one, are health disparities, which our President Cedric Bright has enunciated so well. Dr. Bright continues to be a champion for ending health disparities and increasing health equity, which is the major emphasis of the National Medical Association. Hepatitis C is a major focus for the National Medical Association this year and in coming years, as well as we released our national congestive heart failure in African Americans expert panel paper. We call it the consensus panel paper, where we now attack congestive heart failure as a major issue in the African American community.
And what will your initiative involve?
Our initiatives involve educating and bringing together physicians and patients. We have a national motto and a national program titled, "We Stand With You, NMA Physicians and Patients United for Better Health for All." That really is the goal of the NMA, especially in this time with the Affordable Care Act, it's now implementation at the states. Patients and physicians must stand together to attack health disparities.
I would suggest that people can go to our website at www.nmanet.org. That's www.nmanet.org.